So today marks the second day of the visit of the Gavi high-level mission to Nigeria, which really is targeted at looking at the accountability framework that was developed since 2018 between Gavi and Nigeria. So a sort of indicators around how we're doing reaching our kids with vaccines, how primary healthcare is being funded, some of the key indicators around the budgetary allocation towards the health sector, towards primary healthcare, and also how we're doing in terms of making sure that we have provided adequate resources to procure vaccines for our kids. So for the next 2 days, these delegates that are from different countries will be here, engaging with the Federal Ministry of Health, MPHCDA, and the Nigeria Governors Forum. So it's really an exciting opportunity for us to evaluate and assess what we've done in the last couple of years. And from the preliminary feedback that we're getting, there's a lot of progress that has been made, but there's still so much work that needs to be done. I can tell you, up front that the evaluations are good, because even before their visit, we've already done a desk review of where we are. We're meeting most of the indicators, and then those indicators that are sort of borderline are around, things that we cannot have any control over. So, for example, because of the COVID-19 pandemic and the lockdown, people were not able to take their kids to the vaccination centers or access health facilities. These, of course, will have an impact on some of the indicators. But overall, despite the pandemic, we've seen that Nigeria has made significant progress. Again, we want to reach a situation where all eligible kids in Nigeria are vaccinated. Unless and until we reach those types of numbers, we will not be satisfied. We have to look at not only the coverage, but also equity. Those who live in rural areas, the poor, the vulnerable, we want to get the vaccines out there to them and make sure that they are protected from vaccine-preventable diseases. So the evaluation, of course, will be positive, but we don't want to stop at that. Nigerians deserve the best in terms of healthcare. They deserve the best in terms of access to primary healthcare services, and that is what we're working with our global partners to achieve, and we're on the right course.
I'm here representing UNICEF, and really happy to see firsthand the implementation of the overall vaccination. And we are looking, of course, at the routine vaccination, but also at the COVID-19 vaccine. And as you know, UNICEF and the government of Nigeria, but also together with other partners, Gavi Alliance partners, we've been working very, very closely and to address all the needs for children with routine immunization, but also addressing the challenge that the COVID-19 has put forward. It is really great to see here firsthand the installation of the ultra cold chain and overall cold chain that is receiving massive capacity of vaccines that are coming in the country. If we're to compare with previous years, Nigeria used to receive 4 shipments of vaccines per year, which were planned, and now we're talking about 200 shipments in a year. So that shows already on the hard work that the government at all levels, but also partners, UNICEF and all partners are doing on the ground. And we also are seeing firsthand the need for further expansion of the overall cold chain capacity, not just at the nation level, but also looking at the regional level, having potentially hubs that will really unlock and fast-track the distribution of vaccines to where they are needed and much faster when they are needed. So really, I would say congratulations to the hard work that is taking place. Of course, there is a long way to go, and we are here to understand, of course, to see the success, but also understand the challenges and support the government in their ambition to vaccinate the children, but also vaccinate the population that are at risk from COVID-19. I think the vaccines are stored, the routine vaccines and the COVID vaccines are stored under standard conditions. So we saw the installation of ultra cold chain equipments that have been installed here, and we understand that other equipments of ultra cold chain has already been transported to other parts of the country. And from what we saw today, they are stored in adequate condition, and we know that there are some vaccines that that need to be put into cold chain facility rapidly, but I understand that this is already being taken care of. But so far, I think it needs, as I said, it needs really an investment with regards to expansion of the overall capacity, and that's what is being looked at and being discussed on how we can support, of course.
We do know that